You're watching Natural Medicine World. I'm Daleen, and we're here with Dr. David Nye to ask him if there's any truth in the statement that women have more gut issues than men. Some research suggests even 6 times more. Hi, David.
Hello, Daleen.
What do you think of the statement?
Yes, I agree. I think that women do have more gut issues than men, and I think there's several reasons for that. I think that top of the list is that they handle their emotions differently. They have a lot more emotional issues perhaps than men. Men seem to suppress their emotions, and the emotions affect the gut. Women have less stomach acid, they have different digestive enzymes, they have a much greater tendency to constipation. So these are some of the reasons why women tend to have more gut issues.
It's interesting that you say that emotions affect the gut. Can you just give us a quick synopsis of why?
A lot of research has been done in recent years about the gut-brain connection, and there's an enormous influence that the brain has on the gut, and vice versa. There's enormous influence that the gut has on the brain. The gut is very responsible for a lot of neurochemicals and transmitters being formed, and there's very much a two-way interchange between the gut and the brain, and this is being explored quite extensively in scientific trials at the moment.
So some call it the crosstalk, and is this where the vagus nerve comes in as well?
The vagus nerve is certainly a very important channel for that, yeah.
Right. What are those common symptoms of gut conditions?
There are a lot of common symptoms which I'm sure most people have felt from time to time. Things like bloating, alternating constipation, diarrhea, or constipation or diarrhea, digestive issues, difficulty with digesting food, heartburn, stomach cramps, nausea, and often these will lead to tiredness and joint pains and various other sort of inflammatory symptoms. So these symptoms together often don't add up to much, but when they persist for a long period of time, then one needs to check it out.
Right. What is the most common condition that you see in your practice with gut discomfort?
I think the sort of general digestive problems, irritable bowel syndrome is probably top of the list. The inflammatory bowel diseases, which are a lot more severe, are much less common and would obviously need to be checked out by a specialist. So I think if somebody has a lot of gut-related symptoms, they need to first of all get checked out properly to make sure that they don't have a more serious condition. So this would involve scopes or scans or x-rays or blood tests, and if that all comes up clear, then we usually end up with a diagnosis of irritable bowel syndrome. There isn't actually a specific test for irritable bowel syndrome because we're dealing with a whole complex of symptoms which are all kind of interrelated. So there's no one test for it, but there are some tests which can be very useful in the management of irritable bowel syndrome. One would be a stool flora analysis, where we analyze the probiotics and bacteria and yeasts and parasites in the stool, because that needs to be corrected. Another one is a test for food intolerances, because if the person is eating foods that are irritating the gut, that's important to make sure those are eliminated. So those are 2 important integrative tests, which are not generally done in mainstream medicine, but are very helpful in managing irritable bowel syndrome.
But so, David, can irritable bowel syndrome be aggravated by prescription medication?
It can, and unfortunately some of the prescription medications that are very commonly prescribed can have negative effects on the gut. One of the commonest prescriptions are acid blockers, which reduce the stomach acid because people have heartburn or ulcers and this sort of thing, and when they're taken chronically for a long period of time, they reduce the stomach acid, which is necessary for digestion of proteins. It's necessary for the absorption of vitamin B12 and zinc and magnesium and various other elements. So that has definitely a very negative effect on the gut. And one of the other common prescriptions are anti-inflammatories, which can of course even be bought over the counter, because anti-inflammatories, non-steroidal anti-inflammatories, have a aggravating effect on the gut, particularly with leaky gut syndrome, and cause more permeability in the gut, which would aggravate the whole scenario of irritable bowel syndrome. The thing with the stomach acid is often, particularly as you get older, your stomach acid levels decline, and the symptoms that you can get from too little stomach acid mimic the symptoms that you get from too much stomach acid. So people are often erroneously prescribed an acid blocker when they actually need to build up their stomach acid.
Right.
So there are natural ways of building up stomach acid by taking beta-N hydrochloride, which will relieve those symptoms that are thought to be due to too much acid. So it can be very confusing.
Yes. And then obviously there's probiotics and herbal medicine, homeopathics.
For treatment, yes, absolutely. There are a lot of herbs that can be very beneficial for treating irritable bowel syndrome. Some of the individual herbs are things like slippery elm, which has been used for many, many years, licorice, peppermint, to name just a couple, which really have a beneficial effect on pains and cramps and soothing the gut. Some of these herbs can obviously be taken singly, but work much better if they're taken in a combination, because they have a synergistic effect, where they sometimes called the entourage effect, where they really have a much better combined effect than taken singly.
There are some nice combinations on the market that's well researched. Safety and efficacy profile is good.
Absolutely.
But a question here is, would you reach for a extract in powder or pill form rather than a tincture, or the other way around?
There's great advantage in taking a tincture, because a lot of these people who suffer with these bowel disorders have difficulty in absorbing nutrients and other things anyway. And when they have difficulty, you want to make sure that they're absorbing to the best of their ability, and a tincture would probably be much better absorbed than a pill or another form. So yes, I think tinctures would be better absorbed and have a quicker and more beneficial effect. The other things that we mustn't forget about are probiotics, because often there's an imbalance in the gut flora, which can be tested for, but even if one doesn't test for it, it's probably a good idea anyway to give probiotics. Some of them are very much more specific, but even a general probiotic can be beneficial.
So apart from a herbal tincture for the gut symptoms and probiotics to restore the flora and the microbiome, you would actively go in there and try to find out what is probably the most common cause for irritable bowel syndrome, which is stress.
Yeah, there's so many ways of dealing with that. I mean, one can look at simple things like meditation, getting regular exercise, managing your stress. And then there are more specific techniques like emotional freedom technique, quantum energy coaching, psychological counseling. All these things are very important, and it depends on what the patient resonates with, what they feel is going to work for them. But I mean, even things like Tai Chi and yoga, all these things have a benefit in calming the body and helping to deal with the stress component.
And I'm sure sunshine is not something to be scoffed at.
I'm glad you mentioned that, because sunshine is very important, because they've shown in studies that vitamin D levels are critical to gut health, and having an adequate vitamin D or an optimal vitamin D level is very important. The laboratories generally accept a level of about 30, but in actual fact we need a level of between 50 and 70. So really high levels of vitamin D, getting your sunshine every day or taking a supplement is really important to the gut.
So in conclusion, I think it's fair to say, mild gut issues, look at your diet, look at what you take in an alcoholic form and so on. But if it becomes a persistent problem, go see a medical doctor.
Well, no, medical doctors often are quite flummoxed at how to deal with irritable bowel syndrome, and they often just focus on the psychological element. So by seeing an integrative medical doctor or an homeopath or naturopath, they would have a more comprehensive approach to dealing with irritable bowel syndrome.
Right. So it's the doctor that you choose that can make all the difference. Doctor like you. Thanks, David.
You're very welcome.